Hi, I'm Dr. Kathleen Coates, and I am the owner of Coates Hearing Clinic. October is Audiology Awareness Month. I want to talk to you today about why this is important and to share a little bit about my personal story. Studies have shown that hearing loss is the third most common chronic health condition in the United States. However, less than 20% actually receive treatment. Other studies found higher rates of depression, anxiety, cognitive decline, and social isolation in adults who experience hearing loss who are not wearing hearing aids or receiving treatment. These statistics prove the need for quality hearing health care, access to treatment, and community education on prevention. That's where we come in. By definition and scope of practice, an audiologist will diagnose, treat, and manage hearing loss, tinnitus, and balance disorders. It requires a 4-year bachelor's degree, then onto a 4-year doctoral degree that includes a 1-year externship. A doctor of audiology has your best interests in mind with a medical background. An audiologist is trained to know the links of hearing loss with other health conditions, to better diagnose the cause of hearing loss, as well as collaborate with other physicians and specialists to help prevent future decline. We use research-based testing and treatment, but it also takes a creative mind for coming up with individual needs and solutions using a patient-centered approach. The most common type of hearing loss is called sensorineural, and it's typically permanent. For that reason, we at Coates Hearing Clinic take the time to get to know patients and treat them like family, because we want them to continue care with us for years to come. Continuity of care is highly valuable. As far as my story, how does one choose to be an audiologist? Growing up, you don't really think about hearing loss unless you or someone close to you experiences it. My mother is a speech-language pathologist, so I always had a base knowledge of how important hearing was in the process of learning and producing speech. I wanted to be just like my mother, so I actually chose a major in speech and hearing science. The hearing just came along with it. There came a time during college when everyone in the class met a fork in the road. I had to decide to continuing on to graduate school for a master's degree in speech-language pathology or receive a Doctor of Audiology degree. Before I could even think about it, I started to notice ringing in my left ear. When the professor was talking about this term called tinnitus, I came to the realization that not everyone hears that. My mother completed a hearing screening on me since she had access to equipment being an SLP. I remember sitting in a quiet room listening to those soft beeps. For part of the screening, I was thinking, I haven't heard sounds in a while. I now know that long pause was actually me missing the sound because I, at age 23, had hearing loss. I remember smiling. Who smiles when they find out they have hearing loss? My mother was, of course, concerned. I wasn't at the time. I wasn't sure why I wasn't worried or concerned, but later figured out that I was so interested in what the next steps were and what was causing it to even realize what was actually happening. I moved to the clinician perspective to patient that day. Since I was in school at The Ohio State University at the time, I was fully tested and evaluated by a bright, knowledgeable audiologist. I realized that this is what I want to do. The cause of my hearing loss is called idiopathic, meaning unknown. But an MRI ruled out any medical cause, such as an acoustic neuroma tumor. As an audiologist now, I'm able to test different technologies and tinnitus treatment as it comes out. It's an exciting time for technology. I see my tinnitus as a blessing, leading me to the career and path in life. My continued mission is to treat all patients like I would want to be treated. We hope you share this video or share your story to help others find good hearing health care. Happy October.